I think we're about ready to start. May, can we go ahead and start? Okay, great.
Yes, please.
Thank you everyone for making the effort and the time to be on this call today for in memory of Hamidah. And we're going to use this as an hour-long opportunity to try and condense our memories of her and all the special times that we've shared with her into a very short time. But this is just a small snapshot of her life with so many of us that we would like to share with all of you. So it's good morning, good afternoon, and good evening, because I know people from all over the world are on this call. And assalamu alaikum to everyone. During the next hour, I'm going to take you through a list of speakers who we have requested to speak on this occasion, because they're connected with special phases in Hamidah's life and have special memories with her. And there is going to be an open time in between for everyone who is not on that invited speaker list to try and share their memories of Hamidah on this forum. And then we hope to end on the hour. So I would like to start off by requesting Subhash to introduce himself briefly. And that's what I'd really like everyone to do, to introduce themselves briefly as they're invited to speak, and also talk about their role in Hamidah's life and how they knew her as they speak. We're going to try and keep each speaker to approximately 1 to 1.5 minutes, so that as many people as possible can come online to share their thoughts. So Subhash, over to you to start the proceedings formally.
Thank you, Lubna. And I don't know what to say. I'm at loss for words. Like, you know, with Hamidah, I had first met her in 2005. So that's when we first met, and kind of like, you know, I'm sorry, Lubna, you asked me to introduce myself. Yes, for those of you who don't know me, I'm Subhash, and I'm one of the permanent directors at ID Global. And Hamidah and I obviously were colleagues, you know, at IID, and I have a long association with her. I will not get into the professional things. I mean, many of you are aware of what you know, an amazing global health you know, specialist she was, and the amazing things she has done. But on a personal level, you know, I've known her since 2005, and with her being gone, it's like I feel like part of me is also gone. You know, she was a friend. Family, she was like a sister to me, mentor. I just don't know so many roles she played in my life. It's really hard to say, like, you know, as I said, it's very painful. And I've always said this. I mean, I used to say this to her, and kind of many of you may have heard it from me as well, like, you know, but she was so nice. She was such a great human being that even an average good person would look bad in front of her. She was so good. Many of us kind of like, you know, in today's world say like, don't be shy away from helping others, like, you know, especially these strangers. She will just go out of the way, like literally whatever it will take to help others. And she was an inspiration for me, and she will continue, you know, to be an inspiration, you know, for me, and I hope many others as well, like, you know, the way she led her life, both personally and professionally. I'll just stop there. Thank you.
Thank you. May, do we have Leila's audio ready to go?
Can we like get someone else to speak as well?
Okay, great. So I'm going to request at this time, if Umrana or Nilofer are online. Umrana or Nilofer, I'm just trying to see if I can get everyone.
Yeah, Lubna, I'm here. It's
great.
Umrana.
So we're going to try, we may not be able to hold to it, but we're trying to keep some kind of a sequence from Hamidah's younger days to you know, people and acquaintances and relationships that she acquired later on in her life. So Umrana is probably from amongst the very early days of Hamidah's student life.
Lubna, thank you. I'm Dr. Umrana Pasha Razak. I was one of Hamidah's class fellows at the Al Khan University. in medical school. And Hamidah and I have known each other since the time we were younger than our sons are today. So a lifetime, really. We became very fast friends as we went through medical school, and particularly when we worked at Community Health Sciences and for many years beyond. She was one of those amazing friends that a person has in their life where for years you don't meet. Times take you away to different places, to different continents, and then you meet and it's just like yesterday all over again. The thing that I want to mention most about Hamidah was just how brave a person she always was. She came, when I met her first, I thought that she was she had very clear ideas about what she thought was right and wrong. But over time, I found that she was so open to every new idea and every new experience. And the one experience that I want to share here with everyone is that in 1995, Hamidah and I, with a bunch of our class fellows, went to Bangkok for our US medical licensing exam. And Hamidah she told me, never eaten seafood before then, never. And she was very resistant to the idea of eating any seafood. And her cousin, Dr. Riaz Qasim, and I kind of forced her to eat seafood at a stand at a roadside dhaba in Bangkok. And literally, we could not have been worse friends or cousin to her, because we didn't make her eat fish or shrimp. We made her eat baby octopus. But as I said, she was brave. She was so brave. She would open herself to every new experience and really immerse herself in that and take away the best from everyone whose life she touched and leave us always hoping for more time, more of her wisdom, more of her kind and gentle strength. I always say that God takes away the best of us early. And really, Hamidah was the best of us.
Umrana, thank you so much. And now I have an audio recording that May is going to help us play of Leila. Leila is a childhood friend of Hamidah. She recorded a beautiful message, mainly because she didn't trust herself to speak live. I think I see her online, but for now, just a recorded message would have to do.
Assalamu alaikum. My name is Leila. Hamidah was a very good friend of mine. We had a very special bond. Our parents were next door neighbors and very good friends. Hamidah and I were born just 3 months apart. We grew up together. She was very close to me and my elder sister. We were sisters, not connected by blood but by heart. We shared lots of things, went to the same school, used to study and play together. We have so many fond memories. Whenever we used to meet, we would share a treasure of childhood recollection for hours. As we grew up, life took us in different directions, but our bond remained strong. We always kept in touch. Hamidah had a very pure heart. She was humble, down to earth and selfless, always there for anyone who needed her. She was a pillar of support for us during the last years of my mother's life. She relocated to Toronto about 5 years back, and it was wonderful to have her in the same city once again. I will always cherish the time we were able to spend together over the past few years. It is a great source of comfort for us that my sister was with Hamidah in her last days. The most difficult moment for me was to say goodbye to her on FaceTime. I couldn't believe I was hoping for a miracle. The void left by her passing will remain with us as long as we are alive. But her love has left memories which no one can steal. She will be missed dearly.
Thank you, Leila. And now over to Shehzad, who many of you know. And Shehzad is Hamidah's husband, a very strong force in her life, who brought out the best and the worst in Hamidah. So over to Shehzad.
First of all, to all of you who have joined from around the world, colleagues and friends at IIB, from my entire family, including Hamidah's parents, Farid uncle and Bilkis auntie, Ezban, my son, and I are so grateful, not only for today, but for everything. I don't really have the words, especially Dr. Lubna and Dr. Amir, the way they've been able to support me in this difficult time is just, I'm short of words. Hamidah and I lived together for 26 years and 1 day, literally. And Hezban for 19 years, and at least 15 of those years, conscious years. The most shocking realization we had that she left us, and we did not really knew who we live with. We just did not consciously realize the giant of a woman that we lived with until she was gone. Hamidah either traveled away from us and sat in a corner and worked all day quietly. We only began to understand the impact and the depth of her work when Dr. Lubna and Amir started sharing the messages they were receiving from around the world from all of you. I feel we took her for granted. We did love her a lot, but she deserved more. I don't know how she did all the things that she did. And she was a caring daughter for her parents, a very loving sister for her brother Kareem, the most amazing mother to Hezban, an amazing human being. And to me, she just gave me a hard time and never allowed me to sit. Huge vacuum in her life. It gives me really comfort knowing that she has left the world a better.
I think Shehzad's internet is cutting off. We're going to have him relocate to another room where it can take it. But if you could start the video in the meantime.
very hard.
May, are we having
Could we?
problems with this?
Yeah, I think there's some connectivity issues. Should
Would
be
you
resolved.
Is it resolved, or would you rather we restart this after a little while?
Yeah, I think we can move on, and then we will try again.
Thank you. Sorry about this, everyone. And if Professor Neil Halsey is online, I'm told that he is online. Would you like to introduce yourself, Professor Halsey, and tell us about the time you've spent with Hamidah?
I'm very happy to. Not sure if you can see me. I turned my video on. But thank you very much for allowing me to say a few words about Hamidah. Many others have already said some of what I was going to say. I'm very proud to have been a part of Hamidah's life. I'm a professor at Johns Hopkins University, primarily at the School of Public Health, but also the School of Medicine. Hamidah came to me via Amr, who was a student of mine, and we subsequently forged really a number of common projects, and Hamidah proved herself to be what everybody else has already said. She is one of the warmest, kindest, most intelligent people that I've had the opportunity to work with. And she worked very effectively with everybody that she worked with. I don't know of anybody who has anything negative to say about Hamidah in any possible way. I enjoyed our multiple projects and the visits to Pakistan and elsewhere with Hamidah. My fondest memories are of road trips from Gilgit to Islamabad, 13 hours, and I talked Hamidah into trying to teach me how to play cricket, the rules of cricket. She was only partially successful, but she persevered through at least 2 of those trips. So thank you and everybody else who is on this video for allowing me to be a part of her life and this celebration of her life.
Thank you so much, Professor Halsey. And, you know, cricket remained one of Hamidah's chief passions throughout her life. The day after she had surgery, she sat up on an armchair and put on the T20 against between Pakistan and India. And, you know, I feel that Pakistan losing the match may have had something to do with her immunity giving up. Really, she was just so passionate about cricket. And I know she must have tried her level best with you, Dr. Halsey, to make you understand this game. And now over to Anita Pasha, who is country director of IRD Pakistan, and a source of strength for all of us who continue to do good work in Hamidah's memory in Pakistan and in other places.
Hello, everyone, and thank you so much for giving me the opportunity to speak. Unfortunately, I never had the opportunity to work with Hamidah on a project, unlike so many other colleagues of mine in Pakistan. But over the last few years, I did get to interact with her more closely on more administrative and managerial tasks. And what always struck me about Hamidah was her incredible levels of efficiency. She was always so quick to get back on anything and everything. I don't think I have ever had to send her a reminder about anything because she was just always so quick to revert back. In fact, I would often tell myself, I have no excuse to delay things because Hamidah is obviously busier than I am and she's able to get to it. So I was kind of holding myself up to her standard. What always also struck me about Hamidah was how, like everybody has said, how incredibly warm she was, and just an incredible listener. I feel like there's so many times where I have just said so many things to her, and she has just gently and kindly listened, and very beautifully offered a solution. And that always struck me as just, how does she do this? How does she? How is she so solution oriented all the time? I know the day after her passing, when I came to the office, the grief in the air was palpable. There was so much pain. There were so many people who came to my room and who talked about Hamidah and shared stories about how she had changed them, she had mentored them, she had taught them, she had guided them. And until that day, I had no idea how much she meant to so many people at IRD Pakistan. And upon reflecting, I wish I wish I could have asked her where she got her strength from, where she learned to be so warm and so kind, and what her secret was. But we usually don't ask such things of the people around us. We usually don't share these thoughts. I think all I ever said to Hamidah was, I love your hair. And I regret that I didn't say more. And I think in what I'm taking away from her passing is exactly that, the need and the importance of sharing more and saying more to the people who are with us, because we know that life is very short. And I can say for certainty that she will be very dearly missed by everybody at IRD Pakistan.
Thank you so much, Anita. And over to Salman Keshavji. Amongst the many, many amazing things Salman does, possibly the least important is that he's a professor at Harvard Medical School. But he worked with Hamidah and for a short time at Shehzad, especially while the center in Dubai was up and active. So Salman, over to you.
Thanks, Lubna. Thanks, everyone. It's so as many people have expressed, I think we're all here in Boston in shock, of the passing of Hamidah. And, as you think about Hamidah, as I think about Hamidah, I think about what she's done in the world. I got to know her well. I think it was after 2008. Mercy and I got to know her through, Amr and Lubna and beginning work with IRD. And we spent some time in Pakistan, and over the time, I guess now 13, 14 years, I've spent a lot of time with her. And so, when I think of her, I think of her action in the world, right? And as we look at the world around, which is so beautiful in so many ways, we also realize that it's so damaged in so many ways. And we're drawn to people who repair the world. And Hamidah was one of those people. And I think all of, everyone here knows that and has been saying that. And it's hard to think of her without using superlatives that seem larger than life. And so when I think of her over these many years, she's warm, she's kind, she's hosted me she and Shehzad hosted me in their home. They've been friends, but when I think of her as a titan for justice. She's indomitable, she's indefatigable, she doesn't give in. And she is one of these people that has had this deep, deep commitment to justice and to mercy, to ensuring that people get care regardless of who they are. And so, you look at her and you think about her focus on care delivery, her focus on families that are really poor and vulnerable, and thinking of systems. And you realize that she was somebody who was just gave her life to the deep practice of empathy, of caregiving. And she helped set up systems to do that and made concrete changes in people's lives. So she had this gift, and that gift was being able to move people and move systems. And I think everyone here knows she did this from Pakistan, to Bangladesh, which was pretty amazing, to the Philippines. She started working with us originally on the Green Light Committee. So she did this in the halls of international organizations in Geneva and so many other places. And of course, we're all in shock. And, even when she was sick, we were receiving notes from her to finish papers that we were working on. So even when she was in the hospital, she wasn't, even relaxing. In fact, I was going to reach out to her to help the Thailand TB program frame their next 5-year plan, when I heard from Lubna and Amir how sick she had become, and Mercy and I were just stunned. So all I can say is, for this titan of justice, this indomitable figure, her passing leaves an empty space in all of our lives, and I think it's going to take a long time for us to heal for that part. But her lesson of what she did in the world is a gift, because it shows how service and the force of will can actually change the world. And I think that's the part that we're going to remember. So thank you.
Thank you, Salman. In fact, one of the last things she told Amir is that you better complete this paper before I die. I don't know if Amir has done that paper. All of us who know Amir's procrastination in getting that last bit done. So, I kind of look back at that memory just the night before she was admitted to hospital. But Amin Malik, who will be speaking next, is somebody who's been mentored by her and has possibly co-authored most of her recent papers with her. So you've set the stage nicely for Amin to talk about her.
Thank you very much. Hi, everyone. It's an honor to speak over here. When I was asked to speak here, I tried to jot down a few things that I wanted to say, but there were so many things that didn't help. So I'll try to cover the most important ones. It was 2013. I had just joined IRD again, working at the TB program at the Indus Hospital. And there was this news that this quote unquote new person was going to take over the program and be the new chair. And it made me a little apprehensive at that point in time. I spoke to Subhash, and he assured me there was nothing, absolutely nothing to worry about. And there wasn't. This was the first time I met Hamidah almost 10 years ago. And we developed a mentor-mentee relationship that grew over many years. She was a really easygoing person, just as comfortable eating street food and frequenting dhabas in Kotri as awing people in international conferences in the Netherlands over there by her work. I learned a lot from her about research, about program, about care delivery. But the three things that I learned from her and that will stay with me were kindness, compassion, and generosity. And I think those are the three things that sum up her work and her as a person. I don't think there was anyone who could say no to Hamidah. Like, she actually got things done. She made it happen. I'm guilty of taking advantage of that many times, asking her to email co-authors on top of my email when I wasn't getting any responses, and she would make it happen. So it was she got things done. She was really generous with her time. It didn't matter how busy she was. Whenever I will text her for a quick discussion, she would immediately make time, regardless of like what time zone she might be in. And as we know, she traveled a lot. When their work is done, a great person would always say, "We did it." And this was Hamidah. She was very humble. She was always willing to share credit with the team, having them at the forefront over always. She was a true giant in the field of global health and health equity, and her work will continue to inspire many and improve the lives of so many patients over the years. I can call her Wonder Woman. I can call her a lot of superhero names, but I think it would be more accurate and more pertinent to say that anyone who does good work in the future in the field of global health, we call them the next Hamidah, because she was truly an icon in herself, requiring no external validation. Yeah, I think I'll stop there.
Thank you so much, Amin. And just linking this up with the Indus TB program where Hamidah worked, May, I think you're ready to start with another try at the video. So let's see how that goes. And then we'll continue from here. Thank you so much, Shazad and Amir, for Shazad is back here. So Shazad and Amir for putting this together. This was tremendously difficult for Shazad, especially to go through a photographic collection spanning a lifetime with Hamidah. But thank you for making that effort, for putting this together. And we'll continue where we left off, the years that Hamidah was in Karachi, our neighbor, part of our home, and led the Indus TB program. So over to Farhana Amanullah, who knows her very well from that time.
Thank you, Lubna. That video, by the way, was beautiful, very well put together, and very touching. So I worked on Hamidah on many projects pertaining particularly for children, and we owe her a huge debt of gratitude for all the work she's done. I met her 15 years ago. I reconnected with her when she was in Karachi on one of her program rescue missions. I think I was already very impressed with her public health background, but what impressed me more was the total confidence that Lubna and Amir had in her abilities to just fix programs, to make them, to get over the humps and to kind of make things run. And I actually saw her do that. She would connect with the most junior members of the teams and all the way up to the the administrative, to administration, to board members, to government officials, and she would, fight for patient rights. She would fight to get innovations accepted, and I mean, really do the things that we honestly did not have the capacity to do. I've seen her do these amazing things. She was indeed a workaholic. She would, on the many times that I've traveled with her, I would sometimes we would share rooms, and I would see her with a laptop in bed, and I mean, I'd be off snoozing. When I'd get up, she would still have a laptop, and it would be like, Hamidah, do you ever stop? She would turn every meeting into an opportunity to connect with people, to connect teams, to find more funding opportunities for our programs back home. I mean, I can go on and on at the incredible things that I've seen her pull over the years. I have many, many fond memories of her. She was a wonderful, wonderful, warm, gentle, amazing person with so much. She would give herself to so many people. She is sorely missed. We are not taking her loss well. I still think that she will, turn up and she will tell me about some innovative grant opportunity that we can work on together. And all I can say is that rest in peace, my friend, and thank you for all that you've done for everyone, for children in particular. And we will see you on the other side. Thank you.
Thank you, Farhana. So the next person is Taposh, Dr. Taposh Roy from Bangladesh. I'm going to make one request to everyone, if they could try and keep their time to just about a minute, because we do want to officially end at 8 o'clock. But what we're going to do is leave this forum open beyond, well, it's 8 p.m. It's going to be 8 p.m. in 20 minutes, my end. But we leave this forum open for as long as people who do have the time would like to stay on and talk about Hamidah with as many people who can continue to stay on. So, so I'm going to request everyone to try and keep it to a minute. Over to you, Taposh.
Thank you, Lubna. So it is difficult for me to say something about Hamidah. So we did so many work together. We are well connected for more than over 24 years. First time I met, so we started our public health career almost the same time with Bragg. First time I met her in a village district. So where she was struggling to understand Bengali with a field worker. So I was also working in that district. So, and she joined with Bragg in Dhaka. So, and she visited that district. So after that, we worked a couple of years together in Bragg Health Program in Dhaka. So during that time, so one thing, important thing I learned from her, so that is, she used to say, tomorrow never comes. So I found her always serious with work. Sometimes we used to say her, so take some rest, so we'll do that tomorrow. She used to say, see, the course tomorrow never comes. We need to finish today's work today. So that was Hamidah from the very beginning of our public health career. And after that, outside Bragg, outside IRD, we did a lot of things. We have so many projects we did together for Bangladesh and outside Bangladesh as well. So for IRD Bangladesh, she was the center point of IRD Bangladesh for all activities. She treated everyone equally, and definitely we'll miss her, but we will not forget her. We'll carry forward her work and visions, and each and every IRD Bangladesh colleague will take action on that. Thank you very much.
Thank you so much, Dr. Taposh. And I would also like to thank those who are leaving comments in the chat. If everybody is welcome to do that, we will be recording these comments and compiling them so that we can put them together for her family to keep with them as a memory of the number of people who loved her. Dr. Sadia Chaudhry from Bangladesh, could I request you to speak?
Thank you, Lubna, and I hope you would excuse me because I can't get my video on. Thank you very much for asking me to be a part of this memorial. Unlike all of you, we came to know Hamidah through Shehzad, and it was after they got married. Shehzad came to me one day saying, "Appa, I've got married. This is my wife, Hamidah, and I'd like to introduce her to you." And I just wanted to say here before I go further that there's been such beautiful tributes laid about her. I didn't want to go into that. I just wanted to share the very few points, the very few but poignant points that were in our lives together, in all of our lives together when she came to work in Bangladesh and even beyond. And so I just would like to focus on that. And I know, as you said, try and focus it on two minutes or 1 minute. So he brought Hamidah to us and said, "Okay, so Hamidah, what can you do?" I'm just sort of trying to, because I've been speaking to her like this since the time I heard that she was not going to be with us anymore. And I asked her what is it that she was able to do. She said, "Appa, I've just come from Pakistan. I'm a doctor, I'm a physician. I've worked with the Aga Khan program, the Community Health Sciences program. So I do know something about working in the community." So I said, "Okay, fine. If you're comfortable with it, just join us today." She went out and did all the required things, and she came and joined us. And she became a part of the BRAC Health program from that one day. But I'd just like to share small little incidents which just shows how brave she was, how intrepid she was, how seamlessly she got into everything. She was a part of everything. And to us, Hamidah was a Bengali. Hamidah was a part of our program, never someone outside, someone who never forgot the tiniest details in all our lives, in our personal lives as well as professional lives. So Hamidah was coming to the office every day. And one day she came to me and said, "Appa, I come in my car. I drive it over here, but I can't park it outside. Can you tell me where I want to park it?" So I said, "But Hamidah, where would you like to park it?" And I actually learned many things from her. She said, "Why can't I park it in the BRAC garage?" I said, "Oh, does BRAC have a garage?" She said, "Yes, BRAC has a garage beneath this building. And I can park it over there." We didn't know because we didn't drive our cars, but Hamidah did. So I said, "Okay, why don't you go ahead and do it? What's preventing you from doing it?" She said, "No, I think they may not like it," which means that she had tried it and they had said, no, you can't do it. So I went down and asked these people, and they said, "But Appa, these are all for BRAC cars and BRAC buses and things like that. Who's she? Why is she going to keep her car here?" So I said, "Well, we have never done it before, but why don't you let her try and park it over here and let's see what happens." So they were really very, very surprised. Who's this little girl coming from somewhere and wanting to park her car here? But because we had asked her, because we had asked them to, they reluctantly agreed. They said, "Okay, fine, you can keep it here." But they said, "If there's any problem, then we will have to ask you to move this away." So I quickly agreed, and Hamidah said, "Ha, thik ache." Sorry, I'm going to lapse into Bangla off and on because I'm talking about her being in Bangladesh. Anyway, so she was there. And then that was the first time that anyone even ever pointed out that she was just another little staff parking her car in the garage, and they took it for granted. She had an ability to blend in so well. She formed very quick friendships over there. And most of the people within the health program and outside the health program became her friend very quickly. And so much so that I remember when she and Shehzad were there, they always thought Shehzad was the person who came in from outside Bangladesh, who was not a Bengali, while he always says Shehzad is a Bengali for us. But they always thought Hamidah was a Bengali and a part of us. And she tried to pick up the language so quickly. She was in a hurry to do everything. And she tried to pick up the language very quickly. So she was out in the field. She was out in the various districts. never having to worry that she would have to drive, to go in a bus to all these districts, stayed in all the field offices. She never complained. I know we complained many times. I've never heard her complain. She went and stayed there. Then around the time when the person who was in charge of the TB program, he was leaving for his higher studies. So we looked around and said, who can take over the responsibility? Because it's a big program, you have to communicate, you have to really be in constant dialogue with the government, with the other partners who are there, and also have an inquisitive, questioning mind, because you will have to build the program, you would have to implement the program and keep on changing it as time goes, which was to have to be completely on their feet. So I looked around and I said, and thought very hard and talked with a few other colleagues, and then went to say to Hamidah, and I said, Hamidah, would you take over the responsibility of the TB program? We were working in, by that time, in already 10 or 11 districts. And by that time, we were also talking about going countrywide in a partnership with the government.
Thank you, Dr. Sadia. I'm going to ask you to pause for just a few minutes. We'll take up this again because we're going to try and complete the official program by 8, allowing people to leave. But, you know, I think you brought so much of warmth and personal understanding of Hamidah. So we'd really want to hear more from you. But if you could just give us a minute to, before Bjarne has to head off, Professor Bjarne was Hamidah's PhD supervisor, and I know how important that phase in her life and that achievement was. The photograph with her with flowers in her hands were taken at home because she defended her thesis during COVID. So she actually did it long distance. So over to you, Bjarne.
Thank you very much, Lubna, and thank you for facilitating this very nice ceremony. That is much appreciated. So I've known Hamidah since 2012 when she came to us and expressed an interest to pursue a PhD. She wanted to learn health economics, but most of all, I understood that, her as a person who was passionate about improving the lives of tuberculosis patients. So I had the pleasure of serving as a main supervising during her PhD project, but I'm not sure who learned most, whether Hamidah learned more health economics from me or the other way. I learned a lot about case detection from Hamidah. It went both ways. So in the interest of time, I just want to say that we will remember Hamidah. I asked some of our fellow PhD candidates how they remember her, and they used the words very kind and considerate, and she was generous with her time and always ready to help. And these are words I've heard many times already today. So clearly this is her. So we will remember Hamidah. On the wall of at the university where we eat our lunch, we have a picture of all the PhD candidates. This is the picture of Hamidah. So we can look at her every time we eat lunch, the staff room, and we will not forget. Also, she will be remembered for her work because she studied case detection, how we can identify the TB patients so we can provide care for them, how this can be done by involving the huge private sector in Pakistan and by visiting people in their homes. So this is work and value that will keep living on and potentially help thousands of people. I'm grateful for having known Hamidah, and may she rest in eternal peace. Thank you.
Thank you so much, Bjarne. And could I request Letitia to pick up the thread here, and then we'll swing into a short chat from Hisban.
Thank you, Lubna. What an honor to be here today. Today we are gathered here as colleagues, family and friends to celebrate the life of Dr. Hamidah Hussain as co-founder of IRB Global, a trusted global health leader, a daughter, a wife, a mom, and a treasured friend. I'm Dr. Latisha Walters, the Deputy Chair of IRD South Africa Board of Directors. I'm humbled by the opportunity to provide a tribute to my fellow IRD South Africa board member and buddy. We could not imagine that when we gathered in June for the IRD Global Meeting in Singapore, that it will be the last time that I would see you in person. You look stunning in your emerald green traditional attire. Our last instant messaging in July ended with you saying, "You're most welcome." That's you, Hamidah. And always answering the phone like, "Hey, Latisha, what's up? You know, let's talk." Our last IRD South Africa board meeting in August would be our last video call. You always showed up in a prepared state to craft solutions and with an unwavering commitment to the implementation thereof. You embodied IRD values in the truest sense. Dear Hamidah, your departure has left a void on the global health arena. The IRD Global and South Africa boards, the lives of your family and friends, but your legacy will remain with us forever. With the way you freely gave your time and talents, being a trusted advisor, and your unpretentious manner of setting and pursuing the global health agenda. May we all be comforted and encouraged to continue playing an active role in building on your global public health legacy. We salute you, my IRD buddy. Dear Hamidah, rest in Godspeed.
Okay.
Could I request everyone else who is not speaking to mute themselves? Thank you so much, Latisha. Hispan, over to you.
So hi, everyone. For those of you who don't know me, my name is Hispan. I'm Hamidah's son. So I obviously have so many different memories of her. I'll skip over those. It will take too long to discuss. Many people came to us asking how they could help, whether they could buy flowers or things. And we said, you know, she wouldn't want that. She'd want the money that you guys are spending on these things to go to something meaningful and good. So we started a fundraiser that has since raised over 25,000 Canadian dollars. The results of which, as you'll see in a short video upcoming, will be going towards early cancer screening in women in developing countries, starting in Karachi and slowly moving out to South Asia.
All over the world, women face health challenges throughout their lives. Some are especially vulnerable as they are unable to access the care they need due to resource barriers and inadequate health systems. There is an urgent need to support women's physical and mental well-being, especially in the Global South. IRD is leveraging its health delivery experience and network across Asia and Africa to provide an integrated, community-based approach by providing safe and affordable care for women focused on conditions that have the biggest impact on their lives. IRD's Women's Health Program will provide comprehensive services to women in low-income communities with a focus on high-burden conditions. When identified early, these interventions reduce long-term morbidity, mortality, and treatment costs, achieving integrated primary and surgical care with accompanying psychosocial support. The Women's Health Program is supported by the Hamidah Hussain Memorial Fund. Visit the link below to donate or reach out to learn more.
Thank you, Hispan, and thank you, May, for having that ready to go. In our faith, we have a strong belief in Sadaqah Jariyah, the good that we do in her memory will all make her other life easier, better, brighter. So we will continue this program in her memory, and we hope it will become a way of benefiting as many women across the world as possible. So I'm going to ask Amir to speak now. These were meant to be the closing remarks. We are 1 minute to the hour, but I'm going to request everyone who possibly can to try and stay on for another 15 to 20 minutes. longer. We're all here for as long as others are willing to stay on. And we will continue with a few speakers who I apologize for them to them for having run over time a little bit. But please do stay on as long as all of you can.
Thanks, Hamidah. Thanks you, Lubna. I am so grateful to see so many friends and colleagues and Hamidah's family here on this memorial. I just wanted to remind everyone that Hamidah truly lived a beautiful and privileged life. She has done things, seen things, been places, fought with people, escaped situations, and navigated politics that very few people, certainly if you would think about, her medical school class, would ever face or take on. I've seen her during the earthquake and response in Pakistan take on a colonel, and Hamidah would take anybody on. She would take on army folks in Pakistan. She took on army folks in Russia when she and I were in a certain situation there. She wouldn't back down. She wouldn't back down for her patients. She wouldn't back down for friends and colleagues. She was always ready to fight the good fight. And that's what I remember most. And that's what I'm going to miss the most about Hamidah. I'm also going to miss her generosity. Many of you will not know that in our early formative years and in our troubled times in building IRD, so many of you are part of that journey, but Hamidah would make sure that we were always able to pay salaries. We were always able to make sure that our obligations were met at her personal expense, and never talked about it, never mentioned it to us. She was always there. And so I'm deeply, deeply grateful to her parents and her family, Shahzad and Hizban, for sharing her with us, for all of you, for the lovely things that you have said. And just, remember, this was somebody who lived an extremely privileged and a very beautiful life. And so thank you for being here to memorial that. Thanks very much.
Thank you so much. And we're at the hour. For those who have to head off, we understand. For those who are staying, I would like Courtney from the Harvard Medical School to say a few words. Courtney, are you still on? Okay, so if Oscar Corden from Action Against Hunger is on, he's not on either. Okay, and Charles Lehman from USAID, not on. I'm sorry. I think these are people who had to step away at the hour. And again, I apologize for the delay. Jake, I know you're still on. Could I request you to go? Is Jake still on?
Sure. Yeah. Hi, everyone. My name is Jacob. I work at the Stop TB Partnership in Geneva. And I had the great pleasure of working with Hamidah, as others have said, on many projects, collaborations over the years. She was a grantee, but also an advisor, collaborator on Zero TB, someone to go to for thoughtful advice, and of course, above all, a friend. I learned a lot from her on all her work around costing, how to look at interventions from an economic standpoint. She was, of course, interested in the most impactful interventions, but I think, as many other people have said, she kept the people who had TB front and center, and her work has informed global policy for TB. Hamidah developed wonderful interventions on childhood TB in Pakistan, in Bangladesh, as others have said. And we were really excited to support her work and the work of IRD through several TB Reach grants. again, especially to help diagnose children with TB. And I want to echo what a lot of others have said about that she was universally appreciated and liked. Even if people disagreed with her very progressive ideas to help all people and provide them the best care. She was always positive, looking for ways to improve programs, try new ideas. She was always easy to work with. And as a STAR TB Reach grantee, we asked her to be on our review committee earlier this year. And despite breaking her foot a few days before the meeting, she made it to Bangkok on like a 30-hour flight, was up every morning, reading and engaging with all the other people in the meeting. And of course, we later learned that she did this with a pulmonary embolism. So I was lucky to be in her presence for those last few weeks in September before she passed away, and enjoyed the time with her, and really appreciated her expertise and advice, and I miss her a lot. Thanks.
Thank you, Jake. So Bia, who heads IRD's youngest and probably the smallest team, is online, but she's recorded a message just because they're going through some weather issues in the area and she didn't want to be caught out by bad connectivity. So over to Bia's recording.
I'm sorry, Lubna, but I think there are some issues with the video. We can move on. I will try again to play it.
You know what, Bia, why don't you do this live?
Yeah, why don't you just,
Thank you, Lubna and me. Good evening, everyone. I am Bea Carrascal from IRD Philippines. I would have wanted to deliver a spontaneous message, but I think, well, aside from the connectivity issues, my emotions will get the best of me. So I decided to prepare a message for tonight. So I joined IRD Philippines 2.5 years ago. And I was inexperienced, scared, second-guessing myself and doubting my decisions. But Hamidah was my safe space. She was the country's Northern Star. Her criticisms were constructed professionally and always delivered with kindness. Her hard work, it's inspiring. She would insist that we continue with our calls, even if it's either too late or too early her time. And despite this devotion to work, I saw that she values family time the most. So whenever we have important family celebrations or important matters to attend to, she would always say, put family first. There's always time for work tomorrow. Hamidah was a very vital part of the country that we don't know how to wrap our head around the news the first time we heard it. And but like how she would always encourage us for every failed proposals or failed grants, she would always say, just keep on writing, just keep on going. So we will keep on going, Hamidah. We will bring with us all the learning that you taught us. We will always feel blessed for having the chance to be part of the last 2 years of your life. And to Hamidah's family, thank you very much for sharing her with us. We will continue praying for her. And may Allah grant her the highest place in Jannah. Thank you, Lubna.
Bia, thank you so much. That was so sweet. So with this and with the apologies that we will pass on to the three speakers who had to leave, I'm going to open this up. And I know that a lot of our work colleagues have had a chance to speak. There's a lot of our family on as well. So please, if you could raise your hands, I'm going to try and get to as many as possible. We're hopefully May is keeping track of all the wonderful messages in the chat. So we have those from a lot of you. Yes. Okay. So Amar, our our second son, who is here in Karachi, would like to go first.
Yeah, so I'm Dr. Lubna's son, and I knew Hamidah Khala for pretty much as long as I can remember anything. I think, in life, there's the family you're born with, and then the family you make along the way. And alhamdulillah, I was lucky enough for the family I made along the way to be this good. Hamidah Khala, Hisban, Shehzad uncle. And, I haven't seen her since before I left for university. And I think it's been hard for me having been gone, while she's here. But I think it helps remember that she'll remember us in the best possible way. And she's gone, but not forgotten. And we're lucky to have the time we spend with her. Yeah.
Thanks, Amar. And I'm just trying to look for raised hands. But if anyone wants to just unmute and go, please go ahead. Captain Habib?
I just I don't know what to say. Today is a special day. I'm missing her a lot. I worked with Hamidah for around 5 years, 4 years in HR Global, and I heard the sad news when I was not in Pakistan. That was one of the most terrible day I had. I was not able to control myself. My daughter was holding me like a mother that on those moments. She was such a nice person, incredible person. Her decision making was strong. We worked very hard to establish global system, global policies. She would review everything, each and every word, and then we would get online and discuss each and every aspect. We would look 360 degrees, and then we would decide on the policies. So there was, although I've not worked with her on technical aspects in terms of programs, but for the global HR, we worked very closely. My last discussion was with Hamidah was a few days before I left for Canada, I think 3-4 days. And in that too, she requested for few things to be completed, and Allah ka shukr, it was all completed. Or I'm very happy that I was able to work with her. I learned from her, and we exchanged our views, and we were able to do many things together. I can only pray that her soul rests in eternal peace, and she gets the highest place in Jannah, and also that may God give strength to Hisban and Shehzad to bear this irreplaceable loss, and they will keep remembering her. We will all keep remembering her till the time we are here, but everyone has to go, and she was lucky to go early and be in the nicer place compared to us. Thank you so much.
Thank you, Captain Habib. Ballo, can I ask you to speak? Because this time that Hamidah spent with the Scouts and in Vancouver, she talked about it as one of the best times. She never liked Toronto as much as Vancouver. So over to you.
Hello, everybody. I knew Hamidah on a very personal level, and I know all of her achievements. We talked about it all the time, Lubna. I heard all about you. It was lovely to know you from her. I just so that I could get my thoughts together, I wrote a little poem, which I thought was a lot easier for me to express myself. So I'm just going to read that. Hamidah, what a gentle soul. Her surmounted kindness, her spiritual role. It was 2008 when Hamidah and I met. The year our children became a set. Amani was 5, Hisman was 4, Ellie was only 2, but together they weren't a chore. She walked through a restaurant door, formal, poised, and ready to soar. She ate nothing to honor her fast. I quickly realized that this girl has class. It was the interview to become a scout leader. Little did I know how much I'd need her. She spoke little of herself and of her skills. She'd just be happy giving the kids the thrills. So beaver leaders we became, planning and leading the 5-year-olds to fame. A year of singing, hiking, sharing, and fun, all the way until beavers was done. Then up to cubs we moved. From there on end, it can only be improved. Our families were creating a lifelong bond, talking daily as our hearts grew fond. We spoke and planned and met as often as Vancouver was wet. We were inseparable on the phone and constantly dropping into each other's home. I knew Hamidah as a scouter, a friend, a mother. So down to earth, she was like no other. I was aware of all her abilities, her education, and too, her ambition to tackle every nation. To care for all, to love them all, to give to all, a solution for every obstacle. Always humble, polite, and giving to others, silently, efficiently, like the Earth's mother. So damn smart, so amazing. Constantly working, always smiling, never lazing. Then there was the circle of friends. You had so many, but with none did she pretend. We had so many wonderful memories and laughs. From camping at Manning to Shehzad's photographs. But I knew she had dreams to chase. Traveling needed to get done and a PhD to ace. Living in Vancouver would soon be a passing phase, and soon the family would be looking for a new base. Pakistan, Bangladesh to educate the son, then to Toronto for the extended long run. I was not happy with your decision because being together again was my vision. So we made plans for the years ahead to travel, visit, meet, anything, I pled. Nothing would have prepared me to hear of your demise. As I prayed to God, this information was all lies. My heart-wrenching pain, my anger, our loss. I had no doubt in my mind that this was felt all across. I believed that she was an angel on earth for a short time, and we were blessed to be touched by her mighty chime. They say that she is in a good place, but us loved ones here are the ones missing her face. But I just wished, I truly believed this inside, that she's really gone and left us all behind. She was my friend for always and a day, and we will be together one day. We will find a way. You will always be in my hearts and thoughts. What we had was a forever not. Rest in peace, my blessed one. You will be truly missed forever.
Thank you so much, Paolo. And again, sorry? Nishma, I think you would, and Nishma, then I see Saad. Saad's hand up. Yeah. Nishma, please go ahead.
Hear me?
Yes, now we can.
I really don't know where to start from. I know Abi after getting married to Salim, and I'm so privileged to know her. She is such a kind soul, such a heart, such a kind lady. She's always ready to help each and everyone in the family, always stand for us, always stand wherever we wanted her, whether it's for sickness, whether for the child's education, where to go, what to say, how to deal in any family issues, anything, we always look for Api. We know she's in a better place. We all miss her a lot, but she will always be with us in our heart. We all know that she's listening to us. Still, we can't imagine that she's not with us. Thank you so much, Lubna Abba, for arranging this and getting our heart out and speak, which we can't speak in our family where we wanted to. We can speak here as you all are listening and getting privileged to know so many good things about Api. And we are really, really thankful for this. Amir Bhai, Lubna Appa, thank you so much for giving us this stage. Thanks a lot.
Thank you, Neshma. I do want to use this, you've kind of set the stage for me to thank this wonderful team at IRD. We all call ourselves the IRD family, but we've all come together as a family to get through this as well. So putting this together, May, the communications team, Iftikhar, who specially suffered Amir and Shehzad's exacting requirements of how the video should be. I have been sternly told that the video was pixelating when it was playing, so it was not of the quality that they wanted it to be. This video is going to be something that's freely available to everyone who would want it.
Yes, really,
so
really.
At the work end, May will be communicating to anyone who wants a link to the video, and Shehzad will be coordinating it for the family. I hope you see this video on a better screen than we had today, and actually appreciate this was a labor of love for Amir and Shehzad, and a labor of suffering for the design team. But I think it managed to come through very nicely in the end. So thank you everyone for that, May and the communications team, and the wider IRD family for having been there for us and for Shehzad and for Hispan through this very difficult time. But Saad, over to you, and then if there is anyone else who wants to speak, you can either let me know in the chat or message Shehzad or myself. But otherwise, we'll then try and close for today. Saad, over to you.
Yeah, thank you. So I had the good fortune, and Fawzi and I had the good fortune of knowing her for a long period of time in many capacities. As a colleague and friend at APU, in Gilgit with Amir, setting up one of our earlier field sites together, in Baltimore as a neighbor and as a college, not college, but as an office mate. But Hamidah was in her true element in two places, one with her family and friends, and then in the field. I saw her working, especially with women in communities. She made public health cool. She was for equity before it became a buzzword. She was a woman of her time and a woman ahead of her time. And she was a leader in the most modern sense of the word. And, even on the 17th of October, she would text me, with some frequency. And on the 17th of October, she just texted me. And I think she had her diagnosis at that time to congratulate me on something. And so that's what she was, always thinking about others. And if there were so many dimensions to her, but if there's one phrase that could summarize a lifetime of generosity,
it was that she was kindness personified. Thank you.
Saad, thank you. And I'm going to close with a very small, I think it'll create a bit of a visual picture for those of us who worked with her and for her family to understand that while they saw Hamidah as such an important part of their family lives, she was a tiger in the field, really. She really was something else. So she was asked, given the role of providing external evaluation and monitoring for one of the projects, Subhash, your project, and this was the rainy season in Karachi, and she came in for a monitoring visit soon after that. Saira is sitting across nodding knowingly. She came for a monitoring visit to Karachi from Islamabad, and she came back and told us the story. She said, but the team hadn't been to this particular immunization center. So when I went there in the van, they said, ma'am, the road is very bad after that, let's turn back. And she said, so do you really mean bad roads are stopping you from doing field visits? And in typical Hamidah style, she got off the van, marched off with her dupatta and her kussas, and reached the center, shredded everyone for not doing what they should have in the way they should have, and came back and said, nobody goes into the field as much as they should. And that's really what Hamidah taught so many people who've trained under her. You do not do public health, or you do not aim to do good by pushing paper in an office. You do it by rolling up your sleeves, and nobody rolled up their sleeves better than Hamidah did, and going out there and just being out there, because if you're with the people, you understand their needs, you understand what needs to be done. So I hope that legacy lives on in so many people who have worked with Hamidah, who are on this call today, and people that her mentees will continue to mentor. Amin, Maria, so many people that I'm seeing on this first frame, and my apologies for not having all. We've had over 200 participants in the couple of hours we've had. We have over 130 people on the call right now. But I'm going to call it today. And I hope that we will all continue to do things in her memory. There could be small things, there could be big things, because our belief is that this all will go in her book of good deeds. So thank you so much for being here today, and for being such an important part of Hamidah's life. Good night and Khuda Hafiz.